St. Michael's Hospital in Denver hums with fluorescent lights and antiseptic smell at 2 a.m. Ashley Cooper moves through the ICU with efficient silence, her hand steady on the medication cart, her posture military straight in a way that reads as stiffness to civilian eyes. She wears scrubs 2 sizes too large to hide the muscle definition underneath. Her combat boots have been replaced with hospital clogs, but the muscle memory of their weight still lives in her stride. 1, 2, 3, 4. Each step lands the same as the last. Precision. Control. The kind of calm that comes from having already survived the worst. The night shift at St. Michael's belongs to nurses like Ashley, the ones nobody watches too closely, the ones who come in while the hospital is sleeping and leave before anyone important arrives. She has worked here for 14 months. She has learned the layouts of for ICU wings. She knows which ventilators wheeze instead of breathe. She knows which for pumps alarm at 2:08 a.m. for no reason except age and fatigue. She knows which doctors leave thorough notes and which ones leave landmines. Dr. Pierce leaves landmines. The faded unit patch sewn inside her jacket lining has been there for 6 years. 455th Expeditionary Medical Group, Kandahar Airfield. She touches it once during shift change, a gesture so small nobody else would recognize it as prayer. 3 fingers. 2 seconds. The size of a postage stamp. The weight of an entire life she doesn't speak about. The jacket hangs in her locker now, worn soft from being folded and refolded, and she touches it the way some people touch crucifixes or photographs. Like evidence. Like proof. Room 347 contains a man who should already be dead. The Air Force colonel, his name is James Whitmore, 58 years old, admitted 8 days ago with a massive blunt force trauma to the anterior chest after a car accident on I-25, has spent the last 6 days unconscious. The ventilator breathes for him. The feeding tube delivers 1,200 milliliters of nutrient solution daily. His wife stopped visiting 4 days ago. His children stopped calling 3 days ago. The hospital chaplain offered last rites yesterday. Today, 15 doctors signed the DNR recommendation. 15 signatures across 15 charts over the course of a single morning. Do not resuscitate. Do not intervene. Resource allocation in the age of scarcity. This is what they call medicine now. Ashley knows none of this officially. She knows all of it absolutely. She knows it because she has read his chart for times. She knows it because she watched the attending physicians filter through his room at 6 a.m. during rounds, each one spending approximately 90 seconds examining a man who has already been written off as unsalvageable. She knows it because she saw the tattoo on his right forearm. Block letters. Military precise. A. Cooper in what looks like ink from a decade ago, maybe longer. The letters have faded like old uniforms left in the sun. Like memories that don't fade, just blur at the edges. The colonel does not recognize her face. She stands at his bedside now, 2:34 a.m., reviewing his intake assessment from the trauma surgery team. His chest wall is wrapped tight with compression bandages. His left side has been shaved and marked with surgical tape. The chest tube, a 36 French tube inserted between his ribs to drain blood and air from his pleural cavity, runs down to a collection chamber that sits on the floor beside his bed. The chamber is labeled Whitmore, James R. in printed letters. She has been staring at that name for 14 months without being able to touch it. The tube should be draining. It should be flowing freely. It isn't. The collection chamber contains approximately 80 milliliters of serous drainage. The intake log from the day shift nurse shows 120 milliliters at the 2 p.m. check. The 6 p.m. check shows 115 milliliters. The 10 p.m. check shows 85 milliliters. The numbers are moving backward. Worse than backward. They're stalling. And when chest tubes stall in comatose patients, it means one of 3 things. Blood clotting inside the tube. Fibrin buildup blocking the openings. Tube placement shifting against the lung tissue itself. None of these things are fatal if you catch them. All of them become fatal if you don't. Ashley stands very still. Her hands do not shake. Her jaw does not clench. She simply exists at the end of a bed in a hospital room with fluorescent lights and a ventilator wheeze and a man whose name she is not supposed to know. She reads the chest tube again. She checks the insertion site, clean, no signs of infection. She checks the patient's vitals. Blood pressure stable at 118/74. Heart rate steady at 72. O2 saturation 97% on the ventilator. Temperature 37 degrees Celsius. Everything normal except the one thing that matters. The tube is failing. The next voice that enters the room belongs to Dr. Pierce. He arrives for early rounds at 2:43 a.m. because he is the kind of surgeon who believes that arriving before the day's shift makes him look more dedicated than the doctors who actually sleep. He is 72 years old, though his hairline suggests otherwise. His hands are smooth and unmarked, the hands of someone who stopped doing procedures 5 years ago and started doing administration. He carries himself like a man who has never had to earn respect, only demand it. When his eyes land on Ashley standing at the colonel's bedside, something like satisfaction flickers across his face. She is where she shouldn't be, doing something she shouldn't be doing, proving exactly what he has been saying about her for months. Night shift assessment, Nurse Cooper. His voice sounds like a tank idling in a garage. Expensive car. Expensive education. Expensive certainty that he is the only person in the room who matters. Vitals check. The Colonel's O2 SATs have been consistent. Cardiac rhythm stable. Ashley's voice is soft. Deferential. Each word placed down like stones in shallow water. Not a lie. Simply a partial truth. She does not mention the chest tube. She does not mention the stalled drainage. She does not mention the 15 doctors who signed his death warrant this morning because that is not something a night shift nurse is supposed to notice. Dr. Pierce moves to the bedside with the confidence of a man who has never been wrong about anything. He glances at the ventilator screen. He checks the 4 lines running into the Colonel's port. He looks at the chest tube for approximately 7 seconds. 7 seconds is how long it takes a competent doctor to recognize that something is wrong. Dr. Pierce spends 7 seconds and sees nothing. The chart shows stable trajectory. The trajectory is what matters. He does not look at Ashley when he says this. He looks at the patient, through the patient, at something beyond the patient that only he can see. 15 doctors reviewed this case yesterday. Each one reached the same conclusion independently. The chest tube drainage has decreased by approximately 35 milliliters in the last 12 hours. Ashley says this quietly. She is still reading the output, still checking numbers, still operating within the framework of her nursing scope. She is simply observing what the data shows. She is not diagnosing. She is not recommending intervention. She is stating facts that any competent clinician could verify in 4 seconds if they bothered to look. Dr. Pierce's face changes. Not much. A small tightening around the eyes. A slight hardening of the jaw. She has done something dangerous. She has contradicted him. Worse, she has been right. Worse still, she has done it in a way that he cannot immediately discredit because the data is objective. The tube is either draining or it isn't. The numbers are either declining or they aren't. He cannot argue with numbers. What he can do instead is weaponize them. The assessment of tube function falls under physician scope, Nurse Cooper. Your job is documentation. My job is diagnosis. He turns away from her, back toward the door, his shoulders tight. Continue monitoring vitals. Note any changes. Do not attempt to interpret data you are not trained to understand. Ashley does not respond. She does not argue. She does not flinch. She simply stands at the end of the bed and watches him leave with the expression of someone who has been here before. Different uniform. Different doctor. Same architecture of contempt. Same belief that credentials are the only language authority speaks. The door closes behind him with a soft pneumatic hiss. The ventilator continues its mechanical breathing. The fluorescent lights continue their hum. The chest tube continues not draining. And Ashley reaches into her jacket pocket, the civilian jacket hanging in her locker downstairs, and touches the faded unit patch, 3 fingers, 2 seconds, enough to remember that she has survived worse than being told to stay silent. But that wasn't the worst part. The worst part arrives at 3:17 a.m. The ventilator alarm sounds first. A sharp electronic chirp that means the pressure inside the colonel's lungs has exceeded safety parameters. High-pressure ventilation alarm. The machine is working harder to push air into a space that is becoming more resistant. Ashley moves without thinking. Her hands reach for the patient's chest before her brain has time to process what's happening. She places her palm flat against his sternum. Hard. Tense. The breath coming through the ventilator is audible now, a slight whistling sound as the lungs resist inflation. The problem is no longer theoretical. The problem is happening right now. The chest tube has stopped draining completely. Blood and fluid have accumulated in the pleural space. The lung has collapsed against itself. The colonel's oxygen saturation is falling. 97%. 94%. 88%. Numbers dropping like a weight losing altitude. She reaches for the phone mounted on the wall beside the bed. ICU unit. Charge nurse. I need a resident in room 347. Now. The colonel's desatting. Possible chest tube obstruction. We need eyes on the lung field. The charge nurse on the other end is someone named Derek who has worked nights for 3 years. Ashley, you know, Pierce said. The patient's SATs are 86 and falling. Please send someone. 3 minutes later, a resident named Dr. Kapoor arrives. He is 28 years old, 3 months into his training, scared of everything except failure. He looks at the ventilator screen. He looks at the chest tube. He looks at Ashley with the expression of someone who has just realized he is in over his head. The tube might be kinked. Or blocked. We should check. That assessment falls under attending scope. Ashley's voice remains steady. She is quoting Dr. Pierce back to him. She is following the chain of command that this hospital has designed to keep people like her from saving people like this. You could page the attending. Dr. Kapoor nods. He pages Dr. Pierce. Dr. Pierce does not answer. The resident pages again. Again, nothing. Meanwhile, the colonel's oxygen saturation continues its descent. 84%. 81%. 78%. The heart rate increases. 89, 102. 114, the machine is registering distress. The patient is in distress. The code team is being assembled by protocol, but nobody has actually asked whether this man wants to be resuscitated, because 15 doctors already decided that answer this morning. Dr. Kapoor looks at Ashley. His eyes ask a question his mouth is afraid to ask. Do something. Ashley's hands are already moving. She reaches for the chest tube and examines it carefully, her fingers tracing the path from insertion site to collection chamber. Halfway down the tube, approximately 8 inches from the patient's skin, she feels it. A clot. A plug of coagulated blood the size of a marble sitting inside the tube like a brick in a drainpipe. She does not attempt drainage. She does not attempt flushing. She does not do anything that would require a physician's order. She simply removes the collection chamber and manually strips the tube with her fingertips, using gentle, firm pressure to push the clot backward, back toward the chest wall, back into the space where the lung can absorb it, back into the body it came from. The clot moves. 3 milliliters of dark blood drains immediately. Then 50. Then 100. The ventilator pressure drops. The alarm silences. The oxygen saturation climbs. 79%. 82%. 88%. 92%. The numbers moving upward now, like rescue arriving. Like intervention succeeding. Like a patient who was supposed to be dead at sunrise is suddenly breathing again. The silence in the room is so thick you could operate in it. Dr. Kapoor stares at her. What did you just do? Strip the chest tube. Standard nursing intervention for suspected obstruction. Ashley reconnects the collection chamber. The tube drains freely now, the fluid flowing the way fluid should flow when nothing is blocking it. The Colonel's oxygenation is stabilizing. We should tell Pierce. He needs to know the tube was obstructed. I know. Dr. Kapoor leaves. Ashley stays at the bedside, watching the Colonel's chest rise and fall with the ventilator's rhythm, watching a man breathe who should be dead right now according to 15 different doctors who decided his survival wasn't worth the effort. She does not touch the unit patch sewn into her jacket. She does not let herself feel anything at all. She simply stands there in the fluorescent light and the antiseptic smell and the gentle hiss of oxygen flowing into lungs that have no idea they have just been saved by someone who is not supposed to exist. Thursday morning arrived with the weight of inevitability. The conference room at St. Michael's filled slowly, 20 residents, for attending physicians, 2 nurse practitioners, and Dr. Pierce standing at the front with his arms crossed like a general surveying troops. The fluorescent panels hummed their endless mechanical song. Ashley stood in the back near the door, where she always stood, invisible in her blue scrubs among the white coats clustering toward the center tables. Pierce pulled up the first patient chart on the screen. Not the Colonel. Not yet. He was warming up, building momentum, and Ashley recognized the pattern because she'd seen it before. A straightforward case. A routine admission. Then he clicked to the next slide and her stomach went very still. Her charting notes filled the display in neat, precise handwriting, vital signs documented to the minute, medication times stamped, clinical observations in sequence. Everything was there. Everything was correct. But Pierce had already begun to read aloud. This is what inadequate documentation looks like, he announced, his voice carrying the tone of a man about to perform a masterclass in humiliation. Our night shift nurse believes bullet points constitute a patient history. He gestured at the screen with theatrical disgust, as if the notes themselves smelled of incompetence. No narrative synthesis. No clinical reasoning. Just fragments. Just observations. He said the last word like it was a disease. The resident snickered. It wasn't loud, not yet. But it was there, that social permission cascade where one person laughs and suddenly everyone remembers they're allowed to. Clipboard, Pierce said, still looking at the screen, why didn't you document the patient's baseline mental status? Ashley had documented it. The baseline mental status was there in the third line, recorded at 2,300 hours. She said nothing. Her hands were at her sides, palms facing backward, feet shoulder-width apart, a stance ingrained so deeply it had become her default position. The stance of someone accustomed to standing for hours in observation. Pierce's eyes flicked toward her, and he smiled because he'd gotten the reaction he wanted, no response. No defense. No emotional eruption. Just quiet acceptance of the criticism. It was better than anger. Anger could be defended against. This calm compliance made her look as though she accepted the verdict as fair. He turned back to the screen and kept reading. Every abbreviation became a teaching moment. Every legitimate clinical shorthand became evidence of sloppiness. The room temperature seemed to drop. The air conditioning kicked on with a sudden whoosh, and Ashley could feel the chill on her skin beneath the scrubs, but her face remained unchanged. This was not the worst thing that had ever happened to her. This was not even close to the worst thing. This was a man with institutional power using it like a blunt instrument, and she had learned long ago that the only winning move was to not react to blunt instruments. 23 minutes. That's how long the grand rounds lasted. That's how long Pierce spent dissecting her charting in front of an audience that had been primed to view her as incompetent. By the end, the residents were taking notes on what her documentation lacked. By the end, she had become a case study in how not to practice nursing. When it finished, Pierce nodded like a conductor receiving applause that only he could hear. Ashley had already turned toward the door. 2 days passed like water through a sieve. Thursday to Friday to Saturday, and Saturday afternoon found her standing at the vending machine on the 3rd floor, feeding dollar bills into the slot with the deliberate focus of someone making a simple transaction into a meditation. She'd worked a double shift. Her feet hurt. The shift supervisor had asked her to cover Sunday night as well because they were short-staffed, and she'd said yes because that's what she did. She said yes to every extra shift, every difficult patient, every request that came wrapped in the language of necessity. The footsteps announced him before his voice did. That particular cadence of dress shoes on linoleum. That throat-clearing sound he made before he spoke. Pierce approached the vending machine like he was approaching a podium. Did you buy your nursing degree from the same place you got your military fantasy delusions? His voice was loud enough for the surrounding nurses to hear. Loud enough for the purpose. He gestured at her posture, at the way she stood with her shoulders back and her hands clasped behind her back. Do you think standing like a toy soldier makes you competent? Because it doesn't. It makes you look like you're playing dress-up. There were 3 nurses in the hallway. There were probably 6 more close enough to hear if they were paying attention. The fluorescent lights overhead seemed brighter suddenly, more hostile. Ashley took her selection from the vending machine, a bottle of water, which was what she'd intended to get all along. She turned to face him, and her eyes were very still. You spent 3 minutes explaining why I'm incompetent, doctor, she said. Her voice was quiet. Not timid quiet. Still quiet. The kind of quiet that comes from complete certainty. But you still haven't checked his chest tube. She turned and walked away while Pierce's expression cycled through confusion to indignation to something like alarm. She didn't run. She didn't hurry. She walked with the same measured pace she always used, the same posture that had apparently offended him so greatly, and she didn't look back to see him abandoning the vending machine to move toward room 347. But she knew what he would find. She'd been checking the colonel's chest tube every 2 hours for the past 3 days, and the drainage from the ventilation line had begun to slow yesterday morning, and she'd watched the pattern closely because that's what Captain Ashley Cooper did when she saw something wrong. She paid attention. She documented it. She checked it again. And when it wasn't addressed, she left notes that nobody read and maintained the kind of hypervigilance that existed just below the radar of official concern. The blocked chest tube was still there. Still draining sluggishly. Still threatening to turn into the kind of complication that kills patients overnight when nobody's watching. Pierce would discover it. Pierce would have to address it. And for perhaps 48 hours, he would have to acknowledge that she'd been right about something, even if it came wrapped in theatrical insult. It wasn't victory. It was just survival. But sometimes survival was enough. Wednesday afternoon came with its own terrible certainty. Pierce found her in the medication room at 1,400 hours, just as she was finishing her documentation of the afternoon morphine dose she'd administered to the colonel despite the fact that his pain protocol didn't technically call for an unscheduled medication. She'd made the clinical decision because his vitals were elevated and his breathing was shallow and his body was tense with pain that nobody had authorized her to treat. Captain Ashley Cooper had made the decision the way Captain Ashley Cooper made all her decisions, by assessing the clinical situation and taking the action the situation required. Dr. Pierce's face was white with anger. You don't have the authority to make clinical decisions here, he hissed. The door was closed. They were alone in the medication room with its organized rows of syringes and carefully labeled bottles. You administered morphine without an order. You are a nurse, Ms. Cooper. A nurse. You follow protocols. You don't improvise. You don't make judgment calls about medication administration. Ashley met his eyes. Didn't blink. Didn't look away. Her hands were steady on the medication cart beside her, fingers relaxed, breathing normal. The trembling wasn't fear. It was restraint. It was the physical manifestation of knowing exactly how this was going to end and choosing not to accelerate the timeline. He needed it, she said. That's not your determination to make. Pierce's voice had dropped to a whisper, which was somehow worse than if he'd been shouting. Whispers had venom. Shouts just had volume. I'm going to have security escort you from this building. Today. You're done here. You're finished. I'm filing a formal complaint with the State Nursing Board about your unauthorized procedures, your scope violations, your complete disregard for protocol. You will never work in another hospital in this state. When I'm finished, your nursing license will be a memory. He turned and left before she could respond. Not that she had intended to respond. Response was unnecessary. What was necessary was the understanding that had settled into her chest like concrete, that the thing she'd been running from for 3 years, the thing she'd buried under scrubs and night shifts and the careful anonymity of a woman who was just trying to keep people alive, was finally going to catch up with her. The Colonel's chest tube would be clear by morning. His oxygen saturation would improve. His vitals would stabilize. And Ashley Cooper, the nurse who nobody had suspected was anything more than competent, would cease to exist in any official capacity. Thursday morning arrived without warning. The Colonel's sternum sutures ruptured at 8:19 a.m. during what should have been a routine dressing change, and his chest cavity flooded with blood so fast that Ashley saw it happen in real time, the slow seeping of crimson through the gauze, the way his oxygen saturation began its steady descent on the monitor like a stone dropping through water. She was standing 4 feet away, changing before bag, when she heard the wet sound of it. Not a pop. Something quieter. Something final. She didn't call for backup. She didn't reach for the call button. Her hands moved before her brain finished processing, muscle memory taking over like an engine that had been idling in a garage for 3 years, waiting for exactly this moment. The crash cart was 12 feet down the corridor. She was there and back in 9 seconds, her footsteps the only sound in the hallway, the squeaking rubber soles on linoleum tile, a rhythm that matched her heartbeat. The scalpel was in the top drawer, sterile field opened, the blade catching the fluorescent light like a mirror reflecting something she'd buried in Kandahar dust. 15 doctors had signed the DNR recommendation that morning. 15. Ashley knew because she'd watched Pierce collect the signatures himself, moving through the hospital like a man conducting a symphony, each doctor adding their name to the page with the understanding that Colonel James Whitmore was unsalvageable. Vegetative. A resource drain. Terminal. The word circled through the hospital the way rumors do, gaining weight with each repetition. By 8:38 a.m., the decision was final. The paperwork was filed. The Colonel was being allowed to die, and everyone involved had convinced themselves it was mercy. She didn't have time for mercy. She had 4 minutes, maybe 5 before his cardiac output dropped below sustainable levels, before his brain began dying in increments that measured themselves in seconds. The scalpel felt right in her hand. Cold stainless steel and familiar weight. She made the incision in one smooth motion, left anterolateral thoracotomy through the 5th intercostal space, the blade sliding through skin and muscle with the precision of someone who had done this before in a field hospital 6,700 miles away where the mortar fire was close enough to shake the walls and 72 hours meant time to save 47 lives or watch them all die. Blood spilled everywhere. Across the sterile field. Down her gloved hands. The chest cavity opened like a book written in crimson, and the hemorrhage was immediate and catastrophic. The sutures had failed completely, the sternal edges separated by nearly an inch, and the internal mammary artery was spraying bright red arterial blood in small rhythmic jets. She needed a clamp. She needed suction. She needed surgical tape and a thoracic surgeon and approximately 4 hours of OR time that she did not have. Dr. Pierce arrived 30 seconds later. She heard his voice before she saw him, a roar that came from somewhere down the hallway and grew louder as he ran. His footsteps were heavier than hers, less controlled, the sound of a man moving through panic rather than purpose. When he saw the open chest cavity and Ashley's hands deep inside it, his voice reached a pitch that she didn't know humans could produce. "What are you doing? Stop. Stop right now. Step away from that patient." Ashley didn't look up. Her left hand was clamping the arterial bleed with a satin sky clamp she'd pulled from the crash cart, her right hand working to expose the surgical field, assess the damage, find the bleeding source and stop it before the Colonel's body hit irreversible shock. The monitor was beeping a rhythm that was slowing, 58 beats per minute, then 54, then 51. His blood pressure was 62/40 and falling. She had maybe 180 seconds before his heart decided it was done trying. You are committing a felony. You are practicing medicine without a license. You are. Pierce was beside her now, his hands grabbing at her shoulder, his face the color of a tomato left too long in the sun. Security. I need security in room 347 immediately. She still didn't look at him. Her hands were steady. The thing about field medicine in active combat zones is that it teaches you to ignore everything except the patient in front of you. The artillery doesn't stop because you're concentrating. The screaming doesn't pause because you need silence. You learn to exist in a bubble of absolute focus where the outside world is white noise, and the only reality is the body on the table and the hands keeping it alive. Pierce's voice was white noise now. His hands on her shoulder were white noise. The monitor's increasingly frantic beeping was data, useful, but his rage was background static. She pulled back the ribs with her hands, there was no retractor, no time for equipment, and found the problem. The internal mammary repair had failed at 2 points, the sutures eroded where the artery moved against the sternal edge with every breath. She needed to reroute the bleeding, needed to find a way to arrest the hemorrhage without blowing the entire surgical field. She looked at the clock on the wall. 8:49 a.m. 2 minutes had passed. 2 minutes too many. Get out of my way, doctor, she said, and her voice was different now, not the careful, deferential voice of the night shift nurse who apologized for everything. This was the voice of someone who had made decisions that cost lives when the decisions were wrong and saved lives when they were right, and the weight of both was embedded in every word. Get out or I'll move you myself. Pierce froze. For 3 seconds, he actually froze, his hand dropping from her shoulder as if he'd touched something burning. In that 3-second gap, Ashley threaded a 3-0 polypropylene suture through the torn tissue, repositioning the arterial anastomosis, finding the bleeding points and cauterizing them one by one with a bovie from the crash cart, the smell of burning tissue mixing with antiseptic and blood. The monitor's rhythm began stabilizing. 58 beats per minute. 62, 68. His oxygen saturation climbed, 71%, 76%, 82%. You need to step back right now, she said to Pierce, not looking at him, her attention entirely on the work. Your presence is contaminating my field. Step back or I will have you removed from this room. It wasn't a request. It was a command, delivered in a tone that suggested she had given commands before, to people who understood what happened when they didn't obey. Pierce took a step backward. His mouth opened and closed several times, like a fish pulled from water, searching for oxygen that wasn't there. He tried 3 different times to speak. Nothing came out but incoherent rage. By 8:51 a.m., the bleeding was controlled. By 8:53 a.m., she had begun the closure, suturing the sternal edges back together with the precision of someone who had taught surgeons how to do this under fire. Her hands moved with terrible, beautiful efficiency, each stitch placed exactly where it needed to be, the tension perfect, the depth exactly right. The fluorescent lights hummed their monotonous drone above her. The monitor beeped its steady rhythm, 92 beats per minute, almost normal now, almost stable. The colonel's oxygen saturation had climbed to 94%. Dr. Pierce was standing in the corner of the room by then, his phone in his hand, his face a mask of something between fury and fear. She could feel him watching her. Could feel the weight of his attention like pressure against her back. He was making calculations, she realized. Adjusting his strategy. The thundering rage was being replaced by something colder, something more dangerous, the calculation of a man who had just realized that his narrative wasn't going to work, that the story he wanted to tell about Ashley Cooper, just a nurse, just an incompetent practitioner who should never have touched a patient, had just been rewritten by her hands in real time, in front of a monitor that documented every moment. By 8:55 a.m., she was closing the chest wall, placing the final sutures, and Dr. Pierce was already dialing. She heard him, didn't look at him, but heard him as clearly as if he'd spoken directly into her ear. Board President. Dr. Margaret Hayes. It's urgent. Yes, I know it's early. Tell her it's about the unauthorized surgical procedure happening in my hospital right now. Tell her I need her to authorize immediate action. Ashley tied off the final suture. The colonel's sternum was closed. His bleeding was controlled. His oxygen saturation was 96%. His heart rate was 88 beats per minute, strong and steady. She stepped back from the bed, peeling off her gloves with slow, deliberate movements, her hand still entirely steady, and she looked directly at Dr. Pierce for the first time. "He's stable," she said quietly. "You can call whoever you want. But you're standing in the room of a man who's still alive because I didn't stop working when you told me to." Dr. Pierce's face went white, then red, then a shade somewhere between the two. His phone was still pressed to his ear. His other hand was clenched so tightly that his nails were drawing blood from his palm. What happened next changed everything. Dr. Pierce's hand was still bleeding when he reached his office. The nails had cut crescents into his palm, not deep, but enough. Enough to mark the moment he decided to burn her. He picked up the phone at 7:02 a.m. Saturday morning, before the hospital board president had finished his first coffee. The number was in his contacts, he'd used it before for administrative matters. "Richard," Pierce said, his voice steady as a surgeon's hand. "We have a serious problem at St. Michael's. A nurse. Credential issues. Patient safety violation. I'm calling an emergency meeting." He didn't wait for a response. "This morning. My office. And call the state medical board. I want an outside investigator here before lunch." The board president said something about procedure. Pierce cut him off. 15 doctors signed a DNR on that patient. 15. And she ignored all of us. Performed an authorized surgery. Open chest incision on a do not resuscitate patient. It's textbook assault, textbook endangerment. I have it documented. I have witnesses. The lie tasted like metal on his tongue, but it went down smooth. Lies always did when you were important enough. By 8:56 a.m., Pierce had made 3 more calls. Former colleagues at Denver Presbyterian. The chief of nursing at National Jewish Health. A hospital administrator in Boulder he'd trained under 15 years ago. Each conversation was the same: Ashley Cooper. Night shift nurse. Significant documentation gaps. Personnel issues. Yes, I can be discreet. But the board needs to know before they hire her. He didn't mention that she'd saved a patient's life. He didn't mention that she'd called out his negligence with a single sentence. He didn't mention any of that. By 9:15 a.m., Dr. Hendricks from the State Medical Board was in Pierce's office. She was exactly the type of investigator he'd expected, by the book, detail-oriented, someone who saw violations as puzzles to solve rather than humans to destroy. He showed her the chart. The unauthorized morphine. The missing countdowns. The surgical procedures performed by a registered nurse with no surgical credentials. "This is the extent of it," Hendricks asked, clicking her pen against the tablet. "Isn't it enough?" Pierce said. His voice had shifted now, wounded, concerned. The voice of a man trying to protect patients. She circumvented every protocol. Ignored direct medical orders. Performed emergency procedures without authorization. And the worst part is, she knew exactly what she was doing. You don't perform emergency thoracotomy by accident. Hendricks made notes. Pierce watched the words appear on her screen, each one a nail in Ashley's coffin. "I'll need to review her full history," Hendricks said. "Pull her training records, certification renewals, any prior complaints." "Already done," Pierce said, sliding a folder across the desk. 15 pages. Most of it fabricated. By 11:44 a.m., Ashley's badge had been deactivated by the hospital's security system. Her locker was cleared by 2 administrators who didn't make eye contact. Her name was removed from the staffing board. By noon, the official suspension letter was typed, printed, and scheduled for certified delivery. By 2:19 p.m., Dr. Pierce filed formal charges with the Colorado Board of Nursing. Unauthorized surgical procedures. Patient endangerment. Failure to adhere to scope of practice. The language was surgical, precise, damning, impossible to refute without a full hearing that would take weeks. He sent copies to 3 hospitals: Denver Presbyterian, National Jewish Health, University of Colorado Health. Each one received a call from Pierce first, just so you're aware before she applies. Her career wasn't just ending. It was being erased. Ashley didn't go home after her badge was deactivated. She drove instead, no destination, just the sound of her engine and the city turning grey around her. The mountains were invisible. Everything was grey, the sky, the streets, the dashboard of her old Subaru. She drove until the hospital was gone, until the mountains disappeared, until she was alone on a highway that didn't care who she was. At 3:44 a.m. Saturday, she was sitting in an empty diner on Colfax Avenue. The kind of place that stays open because someone has to. The fluorescent lights above were a shade of white that didn't exist in nature, harsh, surgical, exposing every flaw. The vinyl booth was cracked. The coffee was bitter and had probably been brewing since 8:33 p.m. Friday. She stirred it anyway. The spoon clinked against the chipped mug. Once. Twice. The only sound in the diner besides the hum of the refrigerator and the distant sound of traffic on Evans Boulevard. Her reflection stared back at her from the dark window. Hollow-eyed. Jaw tight. Hair pulled back so tightly it pulled at her temples. She looked like a photograph of someone who wasn't there anymore. A ghost in scrubs. A name on a list of mistakes. 17 missed calls. She'd stopped counting after that. Unknown numbers. 3 from hospital administration. 2 from someone claiming to be an investigator. The rest were probably reporters or lawyers or other people trying to finish the job Pierce had started. She didn't answer any of them. The coffee grew cold. A film formed on the surface, thin, translucent, exactly like the membrane that had formed over her life the moment she'd picked up that scalpel. She'd been ordered to disappear after Kandahar. Not requested. Ordered. Captain Ashley Cooper did not exist officially. She was erased from the record, her name redacted from combat reports, her actions attributed to specialized medical personnel. She was told never to surface. Never to draw attention. Never to be extraordinary in a way that couldn't be classified and filed away in a vault somewhere in the Pentagon. Stay invisible, they'd said. It's the only way to keep the people you care about safe. She'd been invisible for 6 years. Silent. Deferential. A nurse who accepted insults and worked the night shift and kept her head down. And it had taken exactly one emergency to break the only rule that had ever mattered. She'd broken the rule, saved the patient, and destroyed her life in the process. The diner's door opened at 5:12 a.m. A man in a trucker hat ordered coffee at the counter. He didn't look at her. No one ever looked at her until she was useful, and then they looked away as soon as she wasn't. Her phone buzzed. A text from an unknown number. This is the Colorado Board of Nursing. Your suspension letter has been processed. She set the phone face down on the table. The screen went dark. The words disappeared. But they didn't go away. She thought about the 72 hours in Kandahar. The dust that got into everything, your teeth, your lungs, the seams of your gloves. The sound of mortars 2 kilometers out. The way blood looked different in theater light, darker, heavier, like it weighed something. 47 casualties. She could name them all. Could see their faces the way they looked at 3 a.m. when the painkillers started wearing off and they realized they were still alive. She'd kept them alive. Now she was alone in a diner drinking cold coffee on Colfax Avenue in Denver, 3 states away from the mountains of Afghanistan, 6 years away from the last time she'd been Captain Cooper, and about to become someone with no credentials, no job, and no future. The only rule had been, don't surface. She'd surfaced. She'd taken everything down to the bone, the skill, the muscle memory, the training, and she'd brought it into the light. And the light had burned everything. Outside the diner window, Colfax Avenue was starting to wake up. A delivery truck rumbled past. An early jogger ran through the rain. The city was coming back to life, indifferent to the fact that a nurse named Ashley was disappearing from it. She picked up the cold mug and drank the rest. The coffee tasted like metal and regret. But that wasn't the worst part. The worst part was that she'd do it again. If the Colonel's chest tube got blocked, if his oxygen dropped, if his eyes asked her to save him one more time, she'd do it all again. She'd break the rule 1,000 times. She'd been trained to carry lives, not credentials. And now nobody was going to let her carry either. The monitors sang their mechanical hymn when Colonel James Whitmore's eyes opened for the first time in 6 weeks. Not a flutter. Not a gradual awareness. A full awakening, eyelids lifting with the precision of someone returning from an impossible distance, pupil dilation tracking the fluorescent ceiling lights, then sliding sideways to find the figure standing at his bedside. Ashley hadn't moved. She'd learned that much in Kandahar, some moments require stillness. Her hands were steady as surgical steel, her face a mask of clinical observation, but something beneath that mask cracked when the Colonel's lips formed a single word. Artemis. That was her call sign. Not her name. Not the identity she'd spent 3 years erasing. Artemis was the shadow operative who'd held a forward surgical station for 72 hours while mortars rained down on Kandahar Airfield, the captain who'd personally treated 47 casualties when everyone else was running. The woman who was supposed to have died in the desert and been buried in classified paperwork. She took his hand. Said nothing. Sometimes the loudest moments contain no words at all. The hospital administrator appeared within the hour, his face the color of old concrete. He brought a lieutenant colonel with him, dress uniform sharp enough to draw blood, medals arranged in perfect rows down his chest. The administrator's voice shook as he demanded answers. What military connection was there? How had a classified security clearance been hidden in her employee file? Why had the state medical board's background check flagged Pentagon alerts? The Marine colonel stepped forward and opened a folder bound in red tape. His voice cut through the administrator's panic like a blade through silk, each word clipped and precise. For extraordinary heroism under fire, Captain Ashley Cooper maintained a forward surgical unit for 72 hours while surrounded by hostile forces, personally treating 47 casualties with 0 equipment failure and 100% survival rate despite incoming mortar fire and limited blood supplies. Dr. Pierce appeared in the doorway then. His face went the color of ash. The Marine colonel continued, his eyes never leaving the folder. Bronze star with Vela device. Silver star. 2 purple hearts. Her last deployment was classified under JSOC protocols. Captain Cooper's official records were sealed under presidential directive following a black site operation that ended with her medical evacuation. He paused. She was never supposed to surface again. Those were the orders. A 2-star general arrived unannounced at St. Michael's at 1847 hours that same evening. He didn't use the main entrance. He walked directly to ICU, his aide carrying a presentation case, and the moment he saw Ashley, he stood at perfect attention and rendered a salute, fist to chest, held for 3 seconds, the kind of salute reserved for decorated combat veterans. The silver star gleamed under the ICU lights when she'd finally unpinned it from the locked box in her apartment where it had lived unworn for 3 years. The bronze star with V device came next, its ribbon the color of dried blood and copper. The general didn't say much. Generals rarely do. He confirmed her Kandahar call sign. He explained the erasure protocol, how the Pentagon had removed her from official records after the operation went classified, how she'd been warned never to speak of it again, how surfacing would trigger immediate federal complications. He signed 3 forms that officially reclassified her discharge and restored her rank for pension purposes. Before he left, he placed a sealed envelope on her lap. The colonel asked me to deliver this. He's been awake for 4 hours. He asked for you 17 times. What happened next ended Dr. Pierce's career with surgical precision. The state investigator, a woman named Hendricks with the bearing of someone who'd never tolerated bullshit, made a decision Wednesday morning. If Ashley's credentials were classified military, what else was hidden in St. Michael's records? She requested Dr. Pierce's surgical files for comparison, standard protocol when examining scope of practice complaints. Pierce provided them confidently. Arrogantly. The kind of confidence that comes from someone who'd never imagined his own weapon would be turned against him. Hendricks found the pattern within 6 hours. Mortality rates 40% above peer average. Complications attributed to nursing errors. Post-operative reports that didn't match OR logs. She brought in a forensic medical analyst on Thursday. By Friday morning, the analyst had documented it. Pierce had falsified 3 death reports in the past year, listing nursing medication errors as the cause when the actual cause was surgical complications. Pierce had manufactured nursing mistakes as cover for his own failures. One case had ended with prosecution. A night shift nurse named Sarah Chen had lost her license based on Pierce's testimony at a state board hearing. The hospital suspended him pending criminal investigation by noon Friday. Surgical privileges revoked immediately. His attorney showed up at 1,300 hours, but there was nothing an attorney could do with documentation this comprehensive. The 15 doctors who'd signed the DNR recommendation that morning, suggesting the colonel was unsalvageable and consuming resources better spent elsewhere, they were all questioned about their interactions with Pierce. 6 admitted under pressure that he'd influenced their medical opinions, that he'd suggested the colonel was a waste of ICU capacity. Pierce's network, the same weapon he'd built piece by piece over a decade, dismantled him piece by piece in return. Ashley watched from a distance, her face expressionless, her scrubs pristine, her hands, the hands that had performed a field thoracotomy with a combat knife, that had cleared an obstructed chest tube while a doctor screamed at her, that had held lives together through sheer force of will, steady as stone. The colonel asked for her every day. By Saturday evening, she finally entered room 347. His eyes found hers immediately. Artemis. She took his hand and said, "Welcome back, sir." 6 months later, the Denver dawn was the color of old gold, and Ashley stood in the St. Michael's parking lot wearing a new badge clipped to her scrubs. The badge read, Trauma Coordinator. It read, Captain, Rhett. It read, Promoted. Dr. Pierce loaded supplies into a medical transport van on the opposite side of the lot. Medical gauze. Saline bags. Wound dressings. The kind of supply runs given to physicians whose surgical privileges have been revoked, whose license exists under permanent supervision, whose career has been reduced to the work of a technician. His surgical hands had been idle for 6 months. They would be idle for the rest of his professional life. He looked up and saw her watching. Their eyes met across the parking lot. He looked away first, a small gesture that contained everything, and climbed into the van's cab. The engine started with a mechanical wheeze. He drove toward the highway exit without a backward glance. Ashley walked into the hospital and took the elevator to ICU. The doors opened on the 4th floor, and she moved down the corridor with the fluid precision of someone who'd walked these halls through impossibility and emerged unchanged. Room 347. The colonel slept peacefully, his recovery documented as miraculous by any medical standard. 15 doctors had signed the paperwork marking him unsalvageable. Ashley had refused to stop. His left hand rested on a faded unit patch, tan canvas with red lettering, the 455th Expeditionary Medical Group, Kandahar Airfield, the only proof she'd kept of who she really was, the artifact she'd sewn into her jacket lining 3 years ago and carried through Denver like a ghost carrying her own skeleton. He'd returned it to her last week, placed it carefully on her palm with both hands. "You carried this for 3 years," he'd said, his voice still rough from the breathing tube that had saved his life. "I carried you for 3 hours," she'd replied. "We're even." But she'd placed the patch back on his bedside table anyway, anchoring it beneath a small wooden frame. He'd kept it there through his recovery, through the physical therapy, through the 17 different doctors who'd examined him and admitted they'd been wrong. She checked his vitals. BP 118/72. Heart rate 62. O2 sat 98% on room air. She adjusted his performed the quiet competent work that no one sees and everyone depends on, the work that saves lives when the credentials say you shouldn't be capable of it. Before leaving, she wrote in his chart with the precise documentation that had always been her signature: meticulous, detailed, unquestionable. Her closing note in the chart read, "True heroism is what you do when the world stops watching." She didn't know that he'd read that note every day since she'd written it. She didn't know that he'd memorized it, that he'd written it down in the journal his physical therapist had suggested, that he'd finally understood what the 15 doctors had never grasped, that heroism doesn't have credentials. It has hands. It has a heartbeat. It has the decision to keep working when everyone else has given up. The morning light filled the room like gold poured from heaven. Ashley stepped into it, just a nurse, just a woman in scrubs, just another person healing the broken in the darkness where nobody watches. The Colonel slept on, his hand resting on the patch that proved she'd existed in the desert, that she'd been real, that she'd been there. And somewhere in the parking lot, a medical supply van was crossing the state line toward Nebraska, carrying a man who'd finally learned what happens when you pick a fight with someone who has nothing left to lose. If this story reached you, if it made you think about the quiet people in your life, the nurses, the janitors, the ones who work in the shadows, please subscribe and hit that notification bell. Share this with someone who's been underestimated. Comment below, have you ever been judged by someone who didn't know your story? Because I promise you, there are people around you right now who are carrying stories you couldn't imagine. They're healing. They're surviving. They're becoming heroes in the moments nobody's watching. Thank you for listening.